Now it's that time of the year. The kids are either back in school already or headed back soon. Parents, teachers, and students, they're all hoping for a bit more normalcy this year as they begin the third school year in a pandemic. And going into another year and not knowing exactly what to expect can be stressful. But we have someone joining us live this morning who can help. Dr. Donna Housman, a psychologist in child development and early childhood education and the founder of the Housman Institute, joins us this morning. Dr. Housman, thank you for being with us. You have so much good info for parents. We want to jump right into it. Talk to us about the impact on children's development over the past 3 years, particularly our young ones. So we're talking 0 months to 6 years of age.
Yes, without question, we're all concerned about what this time has meant for our little ones, many who have only known a life lived in a pandemic. The ongoing disruption, changes in routine, and social systems being pulled away have resulted in many children facing emotional, social, and cognitive developmental delays. The first 1,000 days of a child's life are critical for brain development, and our youngest have already been living the last 900 days in the midst of pandemic stresses and heightened anxiety, taking a toll on their mental health and learning. And just days ago, the nation's report card showed that math and reading scores have plummeted to the lowest levels in decades among young children. Learning loss has been significant. And we know when the brain is dealing with dysregulated emotion, it cannot learn. And that is why now more than ever, we really need to be helping children learn how to manage their emotions from birth. What happens in the earliest years may make a lasting difference.
And, we want to talk about how parents can do that, right? Because they can hear that, but it can be tough, especially for new parents. So talk to me about how parents and teachers can be proactive and really attuned to children's emotional needs.
Children's emotions are typically expressed in their behavior, and parents and teachers need to know how to read their cues and empathically be responsive to their needs. So what to look for. A range of behavioral changes from increased meltdowns, aggressive oppositional behavior, to heightened withdrawal, clinginess, or worries. Listening for physical complaints such as tummy or headaches. And also, parents and teachers have been struggling with unprecedented stress and anxiety. And children are emotional detectives, tuning into and absorbing like sponges parents' anxiety without the ability to learn and manage their emotions. So the need for teachers and parents to be responsive to children's needs and emotions cannot be overstated.
And Dr. Housman, we want to make sure we give you the opportunity. Is there anything you think is really important for parents getting into this new school year that we did not ask you specifically?
Yes. Children learn through observation and how we model, guide, and respond to them. And therefore, we need to first be aware of our own emotions and model calmness. 3 things to think about. Children need consistent routines and predictability to promote feelings of security and safety. The brain likes and is calmed by predictability. And children's feelings need to be acknowledged, accepted, and valued and validated. And acceptance of feelings does not mean acceptance of behavior. And lastly, ask children open-ended what versus why questions. What are you feeling? What is making you feel this way? And involve them in these solutions so they feel a sense of control. And lastly, remember, being able to deal with your own emotional needs first is really important in order to be able to be there for your children. The oxygen mask rule. And lastly, trust your gut. If you feel something is off, know that early intervention is available for all children up to age 3, or reach out to your child's pediatrician or teacher for additional resources.
Dr. Housman, thank you so much. Good information for parents this morning. We're going to get this up on our website. Thank you so much for joining us. We really appreciate it.